We are joined now by Dr. Sharon Phelan, who is the General Program Chair of ACOG. So nice to meet you. Tell us about what's new and exciting this year at the ACOG conference.
I am so excited about this meeting. We have, under Sandy Carson's leadership, we've managed to have a new educational area. It's the ACOG Hub in the Sales Pavilion. There are interactive games, as featured in the ACOG News. There's the mosaic. I encourage everyone to go put their piece of tile in the mosaic. It's beautiful, and it'll be mounted at the headquarters. They have the advocacy area, and of course the bookstore. We have increasing number of flipped classrooms, which also allow participants to be more interactive in the cases rather than passively sit and listen to a lecture. The app is phenomenal this year. I've been doing this now for a number of years, and the functionality is great. It's very intuitive, so I encourage everyone, even the Luddites in the audience, to try to load that down on their smartphone, their iPad, their computer. It allows you to contact friends that you might not know were here. But what's really fun is it has an audience response feature. And so in many of the sessions, there will be debates and so forth. We'll be polling the audience to see, did they change your mind? What do you think? For Stumpf the professors, we're actually going to let the audience do almost a crowdsourcing where they get to sort of vote on what they think the diagnosis is, and we'll see if the audience does better than the professors in the end. So those are all really new things. You'll see that things like the tote bags, the badges, many of these things are things you might be able to even use back home. And so we're trying to be ecologically a little sound, but meet the needs of the younger population who are dealing with the constraints of practice nowadays.
What do you hope that attendees take away that came to this year's ACOG conference?
Enthusiasm, be rejuvenated in their practice. Burnout's a problem, and hopefully this allows them to contact other folks so that they can have that support, be they in a small private practice or a big academic practice, that they see things they can do new and different and just kind of rejuvenate themselves. We're also hoping that they learn better ways of practice in some areas. Big issue right now is looking at our C-section rates and whether or not we need to modify our practice style. There's a general session on that right now, a number of general sessions on that during this meeting.
Really good information and networking opportunities.
That's it.
Thank you so much, Dr. Phelan.
You're welcome. I hope you enjoy the meeting.